Hello everyone who is watching this video. My name is GABRIELLA SITORUS, and today I'll be presenting about the skeletal system, more specifically the bones, for my SSM. So these will be my table of contents, and there's 5 in total. So I hope you look forward to it. So the first topic will be about the anatomy of the skeleton. As we know, the skeleton consists of 2 main parts, which is the axial skeleton and the appendicular skeleton. The axial skeleton on the right side of the picture that I've shown consists of the skull, the vertebral column, and as well as the thoracic cage, while the appendicular skeleton shows the upper and lower limbs, the pectoral girdle, as well as the pelvic girdle. In the skeleton, there are different types of bones. 6 of main of them is the long bones, the short bones, the flat bones, the irregular bones, the sesamoid bones, and the pneumatic bones. In the picture I have given, I have already color-coded what type of bone belongs to each type of the group that I have mentioned. For example, the long bones consist of the femur and humerus, as you can see from the photo. The short bones consist of the carpal and tarsal bones. The flat bones consist of the cranial bones and the sternum. The irregular bones consist of the vertebrae and the facial bones. And the sesamoid bones consist of the patella. The pneumatic bones, however, is not listed inside of the photo. Therefore, I will only mention that the pneumatic bones can be easily found in the skull region usually. Some examples include the sphenoid and the maxilla. When we delve deeper inside of the bone, we can find the bone cells. One of them is the osteoprogenitor cells, which is responsible for stem cells and producing osteoblasts. Osteoblasts are found on the surface of the bone, and they build bones by secreting collagen and a material called osteoid, which will eventually turn into osteocytes, which are mature bone cells that maintain the bone tissue. Now, let's move on to the next. Now, let's talk about the physiology of the skeleton. The ones that I have listed are 6 in total, the first one being the hematopoiesis. As we know, bone contains bone marrow that is responsible for producing blood cells, and it is also responsible for the support and protection of the body. I say this because the axial skeleton main purpose is to protect the vital organs, while the appendicular skeleton provides stability of the body. It also assists in movements, as when muscle contracts, it pulls on the bony attachment and thus producing movement. The bones also play a role in the bone remodeling process, as it involves osteoclasts and osteoblasts and provides the platform for the process itself. The bones also provide shape, as we know that the height is actually related to the skeletal network of each person's body, and facial features are partly determined by the facial bones of a person. It is also playing a role as a mineral storage, as bone serves as a storage reservoir for minerals, especially calcium and phosphorus. Now we move on to the histology of bones. As we know, histology is actually the microscopic structure of the bones. Inside of the bone, there are 2 main parts, which is the compact part as well as the spongy part. Let me begin to explain about the compact part first. In the compact part of the bone, there exists the haversian system, which involves the haversian central canal, the lamellae, the lacuna, and the canaliculi, as well as the Volkmann channel. So, the lamellae are actually circular layers of the bone and small spaces within the lamella is actually the lacuna. The lacuna holds and contains the osteocytes, and these osteocytes communicate with one another through the caniculi. And the Volkmann channel, which is perpendicular to the osteon, holds the neurovasculature of the bone that contains the blood vessels as well as the nerves. When I talk about the growth structure, it consists of 3 main parts, which is the epiphysis, the metaphysis, and the diaphysis. The epiphysis is the end part of the bone, the metaphysis is the part of the bone that grows during development, and the diaphysis is the central shaft of the bone, which contains the marrow. And then let's not forget about the periosteum and the endosteum. The periosteum is the outermost layer of the bone, and it provides protection for the bone, while the endosteum is the thin membrane that holds the marrow, such as bone marrow, fatty marrow, and hematopoietic marrows. I have also included some of the real microscopic photos of what it would look like inside of the bone. So, you can observe that, and now let's move on to the next slide. Now I'll be talking about the bone remodeling. So, when the bone experiences a fracture, the first thing that would happen is the hematoma formation. Hematoma, or known as blood clot, forms at the fracture site within the first few hours to days. The second step that would occur is the fibrocartilaginous callus formation. So over the 1 to the 3rd week, the fibroblasts and the chondroblasts produce a procallus made of collagen and cartilage for the bone at the fracture site. And then this will turn into bony callus formation as the fibrocartilage is gradually replaced by the trabeculae of primary bone, or what we know as spongy bone, forming a hard callus. Then finally, the bone remodeling occurs. The hard callus is remodeled into mature bone. But how does this actually happen? This happens as the osteoclasts resorb the excess bone formed during the callus stage. The osteoblasts will then lay down new bone in a structured manner, restoring the bone's original shape, as you can see in the formation phase in the bone remodeling photo that I have put. Then, the new bone is reorganized into compact bone on the outer surface and cancellous bone on the inside. FYI, compact bone can also be called cortical bone, while the cancellous bone is also a name for the spongy bone. Now, I'll be talking about the disease related to the bone tissue. One of the commonly known bone disease is osteoporosis. So, osteoporosis is actually a chronic metabolic bone disease characterized by its low bone density mass and deterioration of the bones. As you can see from the photo, what a healthy bone should look like and what a bone with osteoporosis can look like. Some of the symptoms include loss of height, because most patients with osteoporosis usually have a bending pose when they develop this disease, and back pain due to the bone being more fragile and get easily fractured. And fractures as well. As I've mentioned the point earlier, these back pain and fractures are highly related to one another. The risk factors include low body weight, as person who has low body weight has low bone density mass, thus making them more prone to getting osteoporosis. Smoking or using tobacco products also can pose as a risk factor, because this can disrupt the calcium absorption inside the body that is essential for the bone health. The age, as well as person who is older, their bone mass will slowly deteriorate, thus getting them to have a higher risk in getting osteoporosis. Gender too, because women are more likely to get osteoporosis rather than men. Family history as well, because if the family member has osteoporosis, it is most likely that their bloodline will also develop this disease. Some of the causes for osteoporosis is hormonal changes, as women who undergo menopause are more likely to get osteoporosis, as well as nutritional deficiencies. The lack of vitamin D and calcium will affect the bone health, or some medical conditions that cause them to have problems in reabsorbing the calcium and vitamin Ds. Some technological treatments for the osteoporosis involve dual energy X-ray absorptiometry, or we call as DXA scanning, is a modern way to allow early diagnosis of osteoporosis and track bone mineral density over time. This allows doctors to detect early bone loss and predict fracture risk. Another thing is the vertebroplasty and kyphoplasty. Vertebroplasty is when bone cement is injected into a fractured vertebra to stabilize it, while the kyphoplasty is a balloon is used to restore the shape of the vertebrae before the cement injection. And this has helped a lot of patients with osteoporosis. Now, I want to talk about the famous practitioner that I look up to as an orthopedic. So Dr. Che Ping Ching is actually a highly respected orthopedic oncologist in Malaysia with over 30 years of experience. She is also the second female ever orthopedic that is in Malaysia since the year 2000. She currently practices at Sunway Medical Center, Selangor, Malaysia. She completed her MD in 1992 and her MS in 2000 at UKM, and she has completed her fellowship in orthopedic oncology at Rush University Medical Center, USA in 2004. Some of her professional contributions include she is the member of the Malaysian Oncological Society, and she is also the editorial secretary of the Malaysian Orthopedic Association, contributing to academic advancements in orthopedics. So these are my references. Thanks for watching the video. I hope you enjoyed it, and thank you to Prof. Zainal for evaluating this assignment. I hope that this video has shown you what it's like to dive deeper into the skeletal system, and it can benefit you in any form of way and show you that my passion for orthopedics is only growing stronger, and I hope that someday I can actually achieve my dream of becoming a good orthopedic. Goodbye!